Hello everyone. Are you currently taking blood pressure medication? Or have you recently been told that your blood pressure is high? If you listen to what I'm going to share today, it will be a big help for you. By making systematic lifestyle changes, people with high blood pressure can greatly improve their blood pressure management. Of course, these changes should always be discussed with your healthcare provider. Do you know why high blood pressure is so dangerous? It's because it's called the silent killer. Even though there are almost no symptoms, it gradually damages your body. But if you practice the methods I'll share today under your doctor's guidance, you can naturally manage your blood pressure and significantly improve your overall health. Let's start with the first helpful method, mind-body relaxation breathing. This is truly amazing. Just 10 minutes a day can make a big difference in blood pressure management. Many experts recommend this technique for stress relief and blood pressure stability. Here's how to do it. Sit in a comfortable position. Inhale through your nose for 4 seconds. Hold your breath for 7 seconds and then exhale slowly through your mouth for 8 seconds. This is called the 4-7-8 breathing technique. Repeat this pattern 10 times. Doing this twice a day, once after waking up and once before bed, is enough. Why does this work? This breathing technique activates the parasympathetic nervous system, relaxes blood vessels, and stabilizes your heart rate. It also reduces the secretion of cortisol, the stress hormone. One of my acquaintances felt their blood pressure stabilize after just a week of practicing this. The second method is balanced exercise. Everyone knows that exercise is good for blood pressure, but many people don't know what kind, when, or how much exercise to do. The safest and most effective way is to start with light aerobic exercise. Begin with 10 minutes of gentle walking to warm up. Then walk a bit faster for 15 minutes, and finish with 5 minutes of stretching. Timing is important. Exercising between 3 to 6 p.m. is best, as it helps create a natural circadian rhythm that lowers blood pressure at night. Studies show that people who exercise during this time manage their nighttime blood pressure better than those who exercise in the morning. Strength training also helps. Many people think that those with high blood pressure shouldn't do strength training, but that's a misconception. Moderate strength training actually helps manage blood pressure. However, it's safer to use light dumbbells or do bodyweight exercises with slow repetitions. Most importantly, breathe naturally and don't hold your breath. If you're new to strength training, it's best to get guidance from a professional. Now, let's reveal the core method I mentioned earlier, potassium-centered nutrition. This method is simple but surprisingly effective. Including potassium-rich foods in your diet is highly recommended. Examples include bananas, tomatoes, spinach, and avocados. Potassium helps flush sodium from your body, which is important for blood pressure management. According to the American Heart Association, increasing potassium intake has been shown to help manage blood pressure. Isn't it amazing that you can get these benefits from natural foods? However, if you have kidney disease, you need to be careful with potassium intake, so always consult your doctor before making dietary changes. The right amount of potassium varies depending on your health. Here's another important tip. When you eat these potassium-rich foods also matters. Consuming them evenly throughout the day can help you manage your blood pressure around the clock. The third method is smart sodium management. But it's hard to completely cut out salty foods all at once, so here are some practical tips. First, when eating soup or stew, only drink half the broth. Just this can significantly reduce your sodium intake. Second, rinse fermented foods like kimchi and salted seafood in cold water before eating. This removes some sodium while keeping most of the flavor. Third, use natural seasonings instead of artificial flavorings. Garlic, ginger, pepper, and herbs can make your food tasty without adding salt. Garlic is especially good because it contains allicin, which helps manage blood pressure. Fourth, choose natural foods over processed ones. 1 pack of instant noodles contains almost the daily recommended amount of sodium. Instead, try homemade noodles or porridge to reduce sodium intake. The fourth method is the power of sleep. Many people overlook this, but sleep has a huge impact on blood pressure. Lack of sleep increases stress hormones, making blood pressure management more difficult. The ideal sleep duration is 7 to 8 hours, but quality is even more important than quantity. For deep sleep, avoid smartphones for at least 2 hours before bed. Keep your bedroom temperature between 18 to 20 Celsius and try drinking warm milk or chamomile tea before sleeping. If you have sleep apnea, be sure to get treatment. Sleep apnea makes nighttime blood pressure management difficult. and can harm your cardiovascular health. If you snore loudly or stop breathing during sleep, see a sleep specialist. The fifth method is managing stress wisely. Chronic stress is the biggest obstacle to blood pressure management. When you're stressed, adrenaline and cortisol are released, causing your blood vessels to constrict and your heart rate to rise. Over time, this makes blood pressure management more challenging. Here are some effective ways to manage stress. First, meditate for 10 minutes every day. Don't overthink it, just sit comfortably and focus on your breathing. You can use smartphone apps to help. Second, use the power of laughter. Watch a funny video or enjoy humor for about 15 minutes a day. Laughter boosts endorphins and reduces stress hormones. There are many studies on the positive effects of laughter on health. Third, engage in hobbies. Reading, listening to music, drawing, or gardening can naturally relieve stress. Activities involving nature are especially effective. Fourth, maintain social connections. Warm conversations with family and friends are the best stress relievers. Loneliness is a risk factor for poor health. The sixth method is nutritious foods for blood pressure. I've already mentioned potassium-rich foods, but other nutrients are also important. Eat fish rich in omega-3 fatty acids 2 to 3 times a week. Mackerel, Spanish mackerel, and salmon are especially good. Omega-3 supports vascular health and elasticity. Nuts rich in magnesium are also beneficial. A handful of almonds, walnuts, or cashews a day can help, but don't overdo it because they're high in calories. Dark chocolate also has surprising benefits. Eating 23 small pieces of dark chocolate, at least 70% cocoa daily, can help manage blood pressure. The flavonoids in dark chocolate are good for vascular health. Green tea is another great choice. The catechins in green tea have strong antioxidant effects that protect your blood vessels. 23 cups a day is ideal, but avoid it in the evening due to its caffeine content. The seventh method is healthy weight management. Maintaining a healthy weight is a key factor in blood pressure management. Here are some tips for effective weight management. First, don't skip meals. Instead of eating large portions at once, eat smaller amounts more frequently. Dividing your meals into 56 smaller portions a day can help stabilize your blood sugar and blood pressure. Second, drink plenty of water. 8 glasses a day can boost your metabolism and help with weight management. Drinking a glass of water 30 minutes before a meal can help you feel full and prevent overeating. Third, increase your protein intake. Protein helps maintain muscle mass while managing weight. Include chicken breast, fish, tofu, and beans in your diet. Fourth, reduce refined carbohydrates and choose complex carbs. Opt for brown rice instead of white, rice and whole grain bread instead of white bread. The eighth method is the importance of quitting smoking and limiting alcohol. Smoking and alcohol are bad for blood pressure management. Smoking causes nicotine to constrict blood vessels immediately, raising blood pressure. Long-term smokers have a much higher risk of high blood pressure. Your blood pressure starts to stabilize just 24 hours after quitting smoking. After a year, your cardiovascular health improves significantly. If quitting is difficult, consider getting help from a smoking cessation clinic. Alcohol is similar. While some say moderate drinking is okay, excessive drinking directly raises blood pressure. Binge drinking can cause acute high blood pressure, which is very dangerous. For your health, it's best to limit alcohol. The ninth method is accurate blood pressure measurement. Here's how to measure your blood pressure accurately at home. Avoid caffeine or exercise for 30 minutes before measuring. Go to the bathroom, then rest for 5 minutes before measuring. Sit in a chair with your back supported and your feet flat on the floor. Place your arm on a table at heart level. Put the cuff 2 to 3 centimeters above your elbow, but don't make it too tight. Don't measure just once. Measure 23 times at 23-minute intervals and record the average. Measuring in the morning and evening is best. Keeping a record is useful when consulting your doctor. The 10th method is seasonal blood pressure management. Did you know blood pressure changes with the seasons? In winter, blood vessels constrict due to the cold, raising blood pressure. In summer, dehydration from heat can make blood pressure unstable. In winter, keep warm when going outside and avoid sudden temperature changes. Be especially careful when moving between places. With a temperature difference of more than 10 Celsius, saunas and hot baths can also be risky for people with high blood pressure. In summer, stay hydrated. Dehydration thickens your blood, making blood pressure management difficult. When using air conditioning, keep the temperature difference between indoors and outdoors within 5 Celsius. Finally, the most important advice is consistency and collaboration with your healthcare provider. Don't try to start all these methods at once, you'll likely give up quickly. Take it one step at a time. Focus on one method for 23 weeks until it becomes a habit, then add another. For example, practice breathing exercises in the first week, then add a potassium-focused diet the next week. Above all, work closely with your healthcare provider. If you're taking blood pressure medication, never stop it on your own. Discuss the effects of lifestyle changes with your doctor, and consider adjusting your medication accordingly. Don't skip regular checkups. All these methods work best when combined with medical treatment. High blood pressure is closely related to lifestyle. That means you can manage it well with the right habits. If you consistently practice the methods I've shared today under your doctor's guidance, you'll definitely notice positive changes over time. When your blood pressure is well managed, you'll feel lighter, your mind will be clearer, and you'll sleep better. Most importantly, you'll protect yourself from serious complications like stroke and heart attack. Please leave a comment saying, "Starting healthy blood pressure management." Also, let us know which method you'll try first. Sharing your experiences can help other viewers. If you have questions about other health topics like diabetes, cholesterol, heart health, or brain health, please leave a comment. I'll cover those topics in detail in future videos. Subscribe and turn on notifications. Share this video with anyone who struggles with high blood pressure or cares about health. Your small interest can help someone live a healthier life. For healthy blood pressure and a healthy life, start today. In collaboration with your healthcare provider, I'm cheering for your healthy changes. See you in the next video. Thank you.